Welcome to Zoom Into a Career. This series is designed to introduce students to a culture of high achievement by interviewing industry professionals. I'm Andrew Kohler, the Community Relations Coordinator here at Young Community Schools. And today we have Sandra Manwiller, who is a certified surgical technologist at Capital Medical Center. Before we get started, I'd like to remind you that this Zoom is being recorded and will be posted on our website when we are able to post it. Anyway, welcome, Sandra, and thanks for joining us today.
Yeah, thanks. It's my pleasure.
And for those of you who don't know, Sandra's a longtime friend of mine, and so glad that we have the opportunity to talk a little bit. As someone not familiar with the medical profession, what exactly is a certified surgical technologist? And what do you do?
Yeah. So a certified surgical technologist, I guess I should break up the word a little bit. So a surgical technologist is someone who works in an operating room. Specifically, some of the duties that we do are we have to know all of the surgical procedures that a doctor is going to do. We're familiar with all of the instruments. That includes any kind of specialized equipment, any kind of specialized tools that they use, or instrumentation. We track all of our sponges and needles and instrument counts because we never want to leave anything behind inside of a patient because that can cause a catastrophic outcome for the patient. We also, during surgery, we also have to keep track of any fluids that go in and out. Again, everything that goes in must come out. And the most important part that we do as a surgical technologist is making sure that we're not introducing any kinds of microorganisms or bacteria into a patient. It can cause a horrible outcome. So it is our job to make sure that what we're doing is making sure that no one is breaking what we call surgical technique. So everything has to remain sterile at all times, and we have to move our bodies in a way and pass instruments and even move in and out of the operating room in such a way that we're minimizing any kind of that kind of event happening. Certified, I can use that title in my name because at the end of my program, I sat for a national exam and I passed the exam. So now certified means basically that I have to continue doing education credits in order to retain my certification.
And when you're talking about surgeries, what kind of surgeries are you talking about? I know that's gonna probably a wide variety. Can you explain some of the more common ones?
Yeah. So what I particularly do is I work in labor and delivery. So we can talk about that here in a second. But as a student, what you are trained to do is literally everything from head to toe. So you get an opportunity to help in a craniotomy, for example, which is one of the things I got to do as a student. It was very exciting. You can do general surgery, which basically has to do with more of like the intestinal organs, the liver, gallbladder surgery, that kind of thing. GYN or obstetrics is kind of where I am more specialized in. So for example, when a woman has to have her uterus removed for some reason or another, or she's gonna have a baby and we have to do a C-section, that kind of thing. You can do bones, so orthopedics, so you can do that. Yeah, anything really. It's really amazing how far surgery has come. When I first started way back in the early 90s, laparoscopic surgery was the big thing. It was the big emerging surgery. And now we're talking about having robots in the operating room. So as time goes on, you see less sort of open cases, meaning patients are like literally cracked open. I know it sounds kind of weird. And it's less invasive because we find that it's better for a patient to have less of their body parts sort of open to open air.
That's pretty incredible. More like telescopic almost.
Yeah, it's pretty crazy. Yeah.
I mean, even if you look at a knee surgery from 15 years ago to what it is today, the amount of scarring is way smaller.
Absolutely.
So to be in that and to see that evolution has got to be interesting.
It is. It's very exciting. And not only with just the things that we use in the operating room, but even surgical techniques also change so that doctors have to go back to school and kind of learn how to do surgery differently.
And can you dive into what the labor and delivery, maybe not what it looks like, but poor phrasing, but what it looks like?
Yes, absolutely. So, so I am a labor and delivery tech, and typically what surgical technologists don't go into labor and delivery. It just so happened that when I moved up here, there was an opportunity to do OB or obstetrics, and I jumped on it and I really loved it, and I just sort of never went back. Our labor and delivery unit is unique in that my role is not only just working in the operating room. So whenever we have an emergency C-section or a C-section or those kinds of procedures, I'm in the operating room, of course. But then when we're not doing that as a surgical technologist, we're also at the desk. So we're sort of greeting patients and putting in orders in the computer and that kind of thing. So it is a little bit different. It's not something that most surgical technologists learn when you go to school. You don't learn to type in a computer because that's not something that we would do normally as someone who works in the main OR is what I'm going to call it. It's the main OR. Most places don't utilize my job description quite like that. Most places just have a main OR or licensed practitioner nurses will work as surgical technologists in their areas. Like that's what St. Peter's Hospital does. So mine is a little bit unique. There's also another place like up in Overlake that has the same position as I do. So we're kind of split. So we're kind of like secretaries and we also work in the operating room.
Is there did you expect that going into your job, or was that kind of more of a surprise? Or is there anything else that, kind of going off of that, is there anything else that maybe surprised you that you didn't think you'd be doing, but now you ended up doing and had to kind of teach yourself or anything like that?
Yeah, that's a great question. So I was talking earlier about laparoscopic surgery. Just the way surgery is done these days is very different than when I first started. Like I was saying, it's less and less invasive. Labor and delivery obviously is not that way because women can't have babies that way. They can't have it through a scope, at least not yet. So in that sense, that part hasn't changed. But being a surgical technologist, you're not going through your program expecting to learn how to put a patient chart together or to touch paperwork. I guess that's the only way I can describe it. Touching paperwork or putting things in a computer, that is not something that we would have learned. I actually was okay with that because I had worked as a secretary in some other form. So that training was helpful for this position, but I didn't go into this surgical technology, labor and delivery, knowing that I was going to do any of that.
And how did you start and how did you get into your career field?
Yeah, that's a funny question. So when I was in high school, I knew I wanted to go into healthcare, but I also knew that I didn't want to be a nurse. And the biggest reason why I didn't want to be a nurse is I simply can't do math. I am not a math person. And so in order to calculate, medications and stuff, you have to know how to do that. And it frightened me. Like, I don't want to kill somebody, if I got the wrong, medication to somebody. So anyway, long story short, I basically opened up a program for healthcare, and I saw this thing called surgical technology, and I just thought it would be interesting. And I've always been fascinated by the human body. So it just was a perfect fit for me.
And can you dive into some of the training that you had to take?
Yeah, absolutely. So I took my program through a community college. It wasn't here in the state of Washington. It was actually in Texas, but they pretty much are the same. So for example, the community college where you go, you have to take prerequisites. So things like English, math, communications, speech, those kinds of things. Everyone takes that. So when I say everyone, everyone who wants to go into healthcare, we all take the same courses. So the ones that I had mentioned just a minute ago, and including stuff like anatomy and physiology, microbiology, pharmacology, medical ethics. And so we all take these courses together as a group, right? And then what happens is, meanwhile, you apply for the track you want to go to. So for example, if I wanted to be a lab tech, I would apply to the lab tech program. If I wanted to be a surgical technologist, I apply to the surgical technology program. And meanwhile, I keep taking all of the courses that I need in order to get there. So that you get to some point where the program director of the program that you're interested in says, okay, I see that you've taken all of the prerequisites. Now we're going to admit you into the program. At the point that you're admitted to the program, then you dive deep into your program track. So again, you would dive very deep into being a lab tech or a nurse or a surgical tech or x-ray, etc. So that's kind of how that works. And it usually takes about 3 years to finish your program. You can also learn the skills that I've learned as a surgical technologist in the military. So I guess I assume that depending on your ASVAB scores, that you could probably, they would probably choose you to do that, or I'm not quite sure how that works. But the most amazing military or techs that I've learned, I've met and are military trained. They're pretty incredible. And then sort of around that, we have 7 schools here in the state of Washington, 5 of them along the I-5 corridor that teaches surgical technology. And then 2 of them are also in Eastern Washington.
And what would you recommend students do now while they're in high school or about to graduate to help them prepare themselves for either what you do or another job in healthcare?
Yeah, that's a great question, Andrew. So I would recommend that if you're interested in healthcare, I've got sort of 3 recommendations. So the first one would be go work in a doctor's office, volunteer in a doctor's office, or even in a hospital. So how would you know if you would even want to work with patients in general if you're not exposed to that kind of thing? So I would recommend doing that, even if it means that if you're I'm sorry?
Oh, before you continue, sorry to interrupt. How do you become a volunteer and get into the volunteer programs?
Yeah, so I know at our hospital, we usually, I think our communications program director can help set that up. You can usually just call the hospital and say, hey, I want to talk to your volunteer coordinator. And they kind of take you from there. That's kind of how you could do that. And I will just add a little personal story. When I was in college, I worked for the Red Cross as a Red Cross volunteer. I had the opportunity to work at William Beaumont Medical Center in El Paso, Texas, because that's where my dad was stationed. And it was amazing because they found out that I was doing surgery track, surgical technologist. They put me in the GYN ward. So women that needed to go and get their yearly exam, that's where I was at. And that experience actually helped me get my job that I'm at today. So no education is wasted and no opportunity is wasted as well. You will learn so much about yourself by doing that. The other thing I would recommend is concentrate on the sciences, right? That seems like a pretty clear thing. And take communication courses, because you're going to need to learn how to communicate with patients. You're going to need to learn how to communicate with the public. You're going to need to learn how to communicate with each other, in particular in the OR. Studies show that a lot of times to decrease, surgical mistakes and bad outcomes, it all has to do with communication. So people really need to learn how to kind of talk to one another. And then finally, I think it would be helpful if you develop some kind of time management skills or organizational skills. So as an OR tech, I find that I need to organize myself and all of my instruments in such a way that I know where stuff is at, because we have to account for them and I have to count them while we're doing surgery. And so if that goes awry, that's not a good thing for anybody. So that would be
strategies
really
that helped you learn that, or any way that you can improve your organizational skills right now?
Yeah, I would say, I think Miss Suarez, I think I was one of like the tech comp teachers. I think they offer like some sort of computer skills, even something as simple as computer skills, which I know most people have nowadays, will help you be organized. Use any kind of the apps. There's so many out there now that will help you organize your homework, organize your time. Even something as simple as those little things will help you to sort of think ahead, and it will help you as you grow into an adult, and you can take those tools and apply it to so many things. So any kind of time management, even putting things in your planner, that's still a time management and organizational style that you need. And so anything to help you organize your thoughts and organize your processes as you're moving through your day is really helpful.
You've given some great advice to, future medical professionals. If you could give advice to yourself as a freshly graduated senior, what advice would you have given yourself?
Yeah. First of all, I have to just say that I think that Miss Pablo has created an amazing CTE program. The opportunities that kids have now to explore what you want to do starting in the 8th grade is invaluable. And I wish I would have had that experience as well. It may not have changed my choices, but it might have, you never know. So anyway, that's really amazing. So I have 3 words of wisdom, I guess, that I would love to impart with your viewers. And the first one is to learn to take an initiative. What does that mean? It means learn to be a go-getter. So when I'm training somebody new, I love it when they are just like, I want to do that. Let me try. I can't tell you what a joy it is to see people just jump in and dive in and want to do it instead of somebody have to try to push them or they're kind of holding back. I think it says a lot about a person when they want to take an initiative. So learn to be a go-getter. The second thing I would recommend is be curious, ask questions, because chances are that if you have that question, someone else will. So again, that also shows people that you're engaged, that you want to learn, and that you can become a teachable person for any job across the board. And that is always a really good thing to have. Those are good skills to have. And then lastly, I would ask that when you see a need or when you see somebody that needs something, instead of asking them, do you need help? The best thing I would recommend is not to ask that question. The better question to ask is, how can I help? So there is a difference. So if you say, do you need help? Sometimes people go, nah, I got it, forget it, I got it. And it doesn't invite a conversation to open up. But when you ask something like, how can I help? It invites the person to say, yes, I would love for you to help me in XYZ. All of those 3 things that I've talked about, taking initiative, being curious and asking questions, and how can I help, really stand out in people's mind in any internship opportunity or volunteer opportunity that you have, because it shows people that A, you care, B, that you're teachable, and C, they're going to remember that you kind of like stood out from the crowd, that you went out there and you gave it your all, and they'll remember that if you come back for either a letter of recommendation or even a job. So if you remember those 3 things, I think you will do well in any job that you ever apply for, or any internship, and just moving forward.
As a communications person, I just want to high five you and say thanks for reiterating how you say things, how can I help versus do you need help. I think that's really good advice, and being open about it versus if you ask do you need help, it can put people in a position where someone's noticing that I'm struggling with something maybe, versus and then you can get defensive, versus how can I help you. It's much more inviting, and I almost challenge everyone to look at phrases that they commonly say and dissect them, and how would that come off to me if I said it that way? So again, high five when quarantine is over. I will high five you.
That sounds great.
um, anything that we haven't talked about that you would like to add? Bits of wisdom or anything?
Yeah, I guess I would finally just add that, healthcare is a very changing industry. I'm sure we see that right now. It's been interesting to watch from my perspective a global pandemic. I would have never have guessed that would have ever happened to us, but here it is. As and then this part is just coming from me, so I just want to clarify that. I think that in healthcare sometimes we have been very reactive in the healthcare industry, waiting for things to happen and then we fix them. And I hope that in the future that we can really learn as a healthcare profession, how to be more proactive. How do we help patients? How do we help people? Just this is just an amazing thing to watch. I've been very lucky working in labor and delivery. I have not had my work affected in the sense of my job. There are many places that, because surgical technologists don't just work in hospital settings, I should have mentioned this before, we also can work in clinics. So like, for example, like an orthopedic clinic or an eye clinic or an oral surgery clinic. Or if you work for a plastic surgeon, for example, they could use a surgical technologist, but all of those places aren't working right now because those are considered elective procedures. Even the main OR, a lot of those folks aren't working right now. And so I really feel pretty blessed that I have not had to really go through that. A lot of my colleagues have. Anyway, so this is just a moment in time where I hope that people are out there really taking the masking themselves very seriously and washing your hands and not touching. It'll be interesting to see what happens, how life looks like after this has sort of been all, has sort of gone away slowly.
Just hopping onto the COVID thing real quick before we wrap up. Are there any extra precautions that you're taking at work and also at home?
Yeah, so at home, we're not doing much different. We do leave the house. We all have masks now. I'm not letting anybody out of the house without a mask. So that has been kind of interesting. In terms of work, we all are definitely wearing N95. The nurses in particular, when they're in with their patients about to deliver babies, they're definitely gowned up in a way that we just didn't do before. And then we're just all wearing masks, period. Like the entire shift. I work 12-hour shifts. So you can imagine after a 12-hour shift, your mask is, you just want to rip it off your face. So it is different. It looks different. And I think going forward, life will feel and look very different for us.
I mean, it's hard to see what that looks like, but I agree. I think we're going to have a little bit of a shift. But anyway, Sandra, again, thank you so much for joining us. It was great to see you, even virtually. I know I miss seeing all my friends. So I'm sure the people tuning in and the future people that'll watch this will really appreciate it. And it's always interesting to hear from people in that profession, especially in a time like we are in now. So I know your sleep schedule is pretty crazy. So again, thanks for spending your few waking hours with us.
Yeah, it's been a pleasure. I do have to add one thing that I meant to say earlier, and I'm sorry, I'm just mentioning it now.
Oh,
so
please.
Someone has my question. The misconception is that we're all nurses. I'm not a nurse. I should just be upfront to say about that. So I'm not a nurse, and the majority of what we do, the majority of the people that look like me and have the same title as me are not nurses. So you don't have to be a nurse to do what I do. In fact, most of us aren't. So just wanted to throw that out there.
Yeah, absolutely. And one of the things, if you're looking to get into it, that Sandra mentioned earlier, is contact a volunteer coordinator at a local hospital and see how you can get involved. Yeah, just give them a call and see what they say. You don't even have to know what you want to do. They'll find something for you.
That's right.
All right, Sandra, again, thank you, and I really hope to see you soon.
Yeah, you too. Thanks so much. It's been an honor. It's been a pleasure.